Bueno, buenos días a todos los que están
Well, good
conectándose en este momento.
morning,
Bienvenidos a
ladies
este
and
resumen del
gentlemen, and those who are connecting.
IQVIA
Welcome to this
2025.
webinar on the
Es una herramienta
2025 Web
clave para
Indicator.
comprender
This is
los
a
tiempos
key
de acceso a
tool
tratamientos
to understand
innovadores en
times of
salud
access
en
to
América
treatment
Latina.
to innovative
Les damos
health
las gracias a todos
treatments
por acompañarnos hoy,
in Latin
pero
America.
antes de iniciar, les quiero
Thank you
dejar
for
unas
joining us today.
recomendaciones
But
sobre
before
la
starting, I want to
traducción
leave you some
simultánea que
recommendations
tenemos el día
about the
de
simultaneous
hoy.
interpretation that we
En la
have
parte
today.
inferior pueden darse cuenta que
At
hay
the
un
bottom
icono
of
de
your screen, you may
interpretación.
find
Entonces ahí le
an
pueden dar clic
interpretation, a globe
en el
icon
botón
that
de
you can
interpretación y
click on
seleccionan el
to
idioma que ustedes
select your
requieran. En
preferred
este caso
language.
estaremos en traducción simultánea en español e
In this
inglés.
case, we will have
Eligen ya cuando uno
Spanish
seleccione el
English
idioma, lo
simultaneous
primero que es ya
interpretation.
mutean
You
o le
can
dan
select
mute
your language, and the
pues
next
al
step
audio
is to
original.
mute
Y pues bueno,
the
para dar
original
inicio,
audio.
nada más y nada menos que voy a presentar
So,
a
to
Janet
begin, I want
Guija,
to
directora ejecutiva de
introduce
FIFARMA,
Janet
quien nos va a acompañar con
Guija,
los
our
datos de bienvenida.
FIFARMA
Janet,
Executive
adelante.
Director, who will join us
Muchas
with some
gracias,
opening words.
José.
Welcome,
Y
Janet.
bueno,
Thank
muy
you,
bienvenidos
Jose, and
todos
welcome
a esta
everyone
presentación
to
del
this
FIFARMA Weight
presentation
Indicator
of the
2025.
FIFARMA Weight
Como
Indicator
muchos de ustedes ya saben, porque me
2025.
han acompañado durante
As
estos
many of
años,
you may know,
FIFARMA se ha
because you've
asociado
joined us
con
for many
IQVIA para
years,
realizar este estudio que mide el
FIFARMA
tiempo que
has
tardan los
come
medicamentos
together with
actuales en estar
IQVIA
disponibles
to look at the
desde su aprobación en
times
la
of
FDA hasta
availability
que
of
tienen
medications
acceso en los
from the
países de
FDA
América
approval
Latina.
until they gain
Nosotros
access in
iniciamos
Latin
este camino
American
el año
countries.
2022 con un
We
estudio que
started this path
trazaba
in 2022
8
with a
países
study
y 2 áreas
that
terapéuticas. En ese momento
scoped
eran
8
oncología y enfermedades raras.
countries
Desde ese
and two
entonces
therapeutic areas,
hemos venido
oncology and rare
evolucionando esta
diseases.
iniciativa y
Since
para
then, we have been
2024
evolving
ya
in this
teníamos
initiative, and by
10 países
2024,
incluidos. Habíamos
we had
incluido a
10
Panamá,
countries included.
República
We had already
Dominicana
included
y 5
Panama
áreas terapéuticas:
and Dominican
oncología,
Republic
enfermedades
and 5
raras, sistema
therapeutic
nervioso
areas.
central,
Um,
inmunología e inflamación y enfermedades
Central nervous systems,
cardiovasculares y
immunology
cardiometabólicas.
and
Bueno,
inflammation, cardiometabolic
así lo hemos mantenido
diseases,
estos años, pero además en esta cuarta edición
and
hemos
it has
dado
remained the
otro paso
same.
hacia
But
adelante.
in
Por
this fourth
primera
edition,
vez,
we have taken one
el
more step
estudio
forward. For the
intenta
first time,
ir un
the
poco más allá de
study
solamente medir
seeks
tiempos de
to
acceso
go
y hemos
beyond just
incorporado un
measuring
análisis de
access
causa
times
raíz.
and
Déjenme
going
llamarlo de
forward
manera
to a root
simple,
cause
en el acceso a los
analysis,
medicamentos innovadores en
precisely
América
because of the
Latina.
delays in access
Estos
to
números,
innovative
estos
medications in Latin
datos
America. This
son
not
tan
only
importantes porque han
provides
sido tan
data,
esenciales en todo
which
este
is so
proceso, pero
important,
también
has been
nos dan
so essential in
perspectivas que
this
pueden
process, but it
orientar
also provides us
soluciones,
with
reformas
perspectives
y
or
esfuerzos
insights
de
that can provide
colaboración en toda la
solutions,
región.
reforms, and efforts
Nuestro
for
objetivo
collaboration
es
throughout the
que
region.
el Weight
Our
Indicator se convierta en una
objective is that the
verdadera
weight
referencia en
indicator will
América
become
Latina,
a true reference
ofreciendo
in Latin
evidencia que
America, true
ayude a los
benchmark,
distintos actores,
offering evidence
legisladores,
that supports
reguladores,
the different
responsables de
actors,
políticas
and I include
públicas, la
regulators,
industria,
policymakers,
organizaciones de pacientes, a identificar cuáles son
industry,
esas brechas
patient
de derecho que tenemos,
organizations to
combatir buenas
identify
prácticas
what the
y
gaps
acelerar
are,
el acceso a la
to
innovación para
share
el bien de
good
los pacientes
practices
de
and
nuestra región.
accelerate access to
Estamos
innovation
muy
for the
felices.
good of our
Siempre nos
patients.
encanta tener
We're
estos
very happy.
encuentros
We're
para
always
poder
very happy to have
compartir con
these
ustedes
meetings
los
to be
resultados
able
de
to
esta
share
última
with you
versión
the
del
results
FIFARMA
of
Weight
this
Indicator
last version
2025.
of the
Esperamos
2025
tener un
FIFARMA weight
diálogo
indicator.
significativo e
And we hope
inspirador.
to
Lo
have a
más importante, que inspire acciones
relevant
conjuntas
dialogue
para
to
garantizar que los
inspire
pacientes en toda América
shared
Latina
actions
puedan
and
acceder
guarantee
más
that
rápido y de
patients
manera
throughout
más
Latin
oportuna a
America
tratamientos
can
innovadores.
gain more equitable
Realmente lo que
access
queremos
to
es
innovative
generar una
treatments.
conversación, generar un proceso de
What we
diálogo
want
y,
is to
¿por qué no?,
drive
generar
conversation, a
acción para lo que
dialogue
estamos
process, and
viendo
why
con
not
nuestros resultados.
action
Antes de
and
terminar, quiero
outcomes.
saludar a Víctor Nashiben,
Before
co-chair del
finishing my
Grupo de
opening words, I
Biomédica
want
e
to
Innovación de
greet Victor
FIFARMA,
Nashiben,
quien estará
president of the innovation
moderando
group
las
at
preguntas
FIFARMA,
del
who will be
público. Este trabajo ha
moderating
sido esencial en todo
the
este proceso,
audience's
nos
questions.
aporta,
Victor
nos
has been essential
apoya
in this
y nos va a
process.
hacer
He's
lo posible.
contributing, he's
Y
supporting us,
también
and it's great to have him
voy a
here.
presentar y
And
ceder la palabra
I
a
will
los líderes
also
expertos de
introduce
IQVIA,
and hand the
Oscar,
floor
Carmen
to
y
the
André Baralay,
IQVIA
para que ya arranquen y nos
leaders,
hagan
Oscar
esta
and
presentación.
Andre, so that they
André y
can
Oscar,
start with the presentation.
bienvenidos.
Andre, Oscar, welcome.
Muchas gracias, Janet. Un gusto estar
Thank you very
aquí.
much,
Un gusto saludarlos a
Janet.
todos
It's
y a
great to be
todas
here with
ustedes.
you. It's great to
Entonces, el
be
día
able
de
to
hoy
greet you
vamos
all.
a cubrir
Today, we're going to
tres
cover
diferentes temas
three
apoyándonos en
different
los datos del
topics
weight que se recopilaron
based on the
a lo
weight
largo de este año.
indicator
Los
data
invito
that was
a
compiled
ver a mi pantalla
throughout the year. You're
y
going to be able to see
les
my
voy a
screen very
dar
soon.
un breve
And
introducción
I'm
al
going to give
estudio,
you a
explicando
brief
cómo se
introduction to this
recopila la
study,
data, cómo se
explaining how the
analiza
data is compiled,
y entramos
how
en
it is
materia.
analyzed,
Acceso, el
and
estado de
then we
acceso
get
al
into the
weight en
topic. The
Latinoamérica,
status of access
causas
today in Latin
raíces y unas
America,
palabras acerca
root
del camino
causes, and
hacia
some
adelante.
words about the way forward. I will be starting. My colleague Andre will present some slides, and then we get started.
El estudio WAIT
The weight study this year, as Janet said, this is the fourth version of it, and with each version we have tried to go further and to start adding new analysis and new ways of looking at this. It offers an overview of the status of access currently, and this covers 11 years of innovations, that is molecules ranging from 2014, approved in 2014, down to 2024 by either the FDA or EMA in Europe. This year, this would include 403 molecules, as we're showing. It contemplates the first indication of these molecules, and we're looking at 10 Latin American countries that encompass 80% of the population. And this also includes over 80% of new active substances that have been launched to the global market and patients globally. And what we're trying to do is to see how this innovation is translated or is reflected into Latin America. A few notes about data compilation and the methodology. This is a study that seeks to use the better and more broadly available data sources. So we start with publicly available data. We are supported by the IQVIA data, which is extensive in all the countries, both locally and regionally. And we have a process of validation and review at a regional level, but by all the IQVIA teams, also using laboratories as allies in validating this data so that it is as current and as extensive as possible. We have involvement from the local associations in Latin America, whether Ecuador, Chile, Peru, and so forth, and they assess and validate the data so that it's as current as possible. And we have different fora and different reports that present the data in different fashions. So we invite you to access FIFARMA websites to download the reports if you want to have a broader, more complete idea of all the data available. One more note before starting with the results regarding interpretation. Throughout the presentation, we will be using these 5 colors to color code the availability status. That is why it's important to identify the colors. First color is this a darker red, and this means that a molecule is not approved, and for the same reason it is not available in a given country. That's not approved. That could be resulting from a lack of submission to the regulatory agents or a review process. The second is approved, not available, or approved no availability. That means that it has regulatory approval in the market. However, it doesn't yet have a form and has no access status. We have 3 more. The next one is only available privately, that is in the private sector. That means that private insurance, health insurers provide access or to some market segments, but it's not available under public coverage schemes. We also have yellow, which is going into the public sector, however, in a limited fashion, because there could be some geographic limitations in different provinces or regions, or there might be restrictions for the therapeutic use as compared to the regulatory approval. And finally, in green, this is full availability. That means that the approved indication by the regulatory agency is available for the general public through Social Security, and patients are able to access therapy. So let us start with the results. We have 4 metrics. The first one is time to availability. How long does a medication, an innovative medication, take from the moment of its global approval either in the United States or in Europe, how long will it take to reach Latin America? Second, availability status. How is availability distributed across the different Latin American countries for innovative medications, and to what degree of access do they reach? Third, availability over time, or the evolution of availability. It measures the maturity of innovative medicines in Latin America. And fourth, the improvement index. It measures against last year how many molecules have shifted their availability status, how many have improved, how many forms have been released or removed. I mean, how much we are advancing as a region in terms of access. So I will present a few of the results, beginning by a broad regional perspective, then moving on to times to availability, and now hand the floor to my colleague Andre. So when we look at the whole region and we look at all the molecules, we can see an availability cascade. On the left-hand side, you can see molecules that are part of the sample. All that are approved in the United States or in Europe are 403. When we look at our region here in Latin America, those that are approved in at least one country, so many are approved in more, and unfortunately, many have been left with just one or two countries. But those that are approved in at least one country are 245 of our sample. So approximately 60% of the molecules of the sample in and the other 40% is not approved in Latin America. The next level of the cascade is extended availability. This is what it means in the private sector or public sector. And from there, we can go down to 179 molecules, which have a certain degree of access. That means that some patients don't have to pay out of their pockets, and this represents approximately 45% of the sample. And finally, availability in the public sector. Available for most of the population in this country. Those that can be found in at least one country with public availability are 131. At least one country. That means that they cannot be found in all the countries necessarily, and this represents 33% of the sample. With that regional perspective, we can move on to time to availability. We see here the times divided on the left, time to approval, starting from the time of global approval, and it is represented in months. So you can see that there's a great variability in the times to approval, because we take into account the time to submission and the time during the process of evaluation. And the regional average of time to approval was calculated at 38 months, a little bit more than 3 years for a new medication to be approved in Latin America on average. I will soon be showing the existing differences between countries in therapeutical areas, and if you can see here in around the mid part, you can see the average. The next part is time to availability, inclusion in national formularies, and time to access for patients. And this average time was calculated at 29 months, approximately 2.5 years. And when you add them up, we're talking approximately about 5.5 years from the moment of approval in the United States and Europe until we get to actual access in Latin America. That is 5.5 years. And finally, on the right-hand side in this slide, you may observe that there's a table with different colors, gray, mainly red, and a glimpse of green. This indicates the comparison between time to access last year versus this year. And what we can see is that the averages have generally been on the rise. That means that we are taking more time as compared to last year for new medications to gain access. Before moving on to my colleague, just another note. This slide talks about the times to availability, leaving aside the time to approval. It only marks the time from the regulatory approval in that country until there is an inclusion in the public sector in these countries. And as you can see, there are some geometrical figures here that are small, and this indicates the different therapeutic areas. I invite you to look at this in greater detail after the call by accessing the online report in the FIFARMA website. We can observe major differences among the different therapeutic areas. That means that not all molecules and not all therapeutic areas are the same or have the same times to access. And we are going to look at other access statuses. So, orphan diseases and molecules for central nervous system diseases have a lower time to availability than other therapeutic areas. Oncology, in none of the cases, is one of the fastest. And in several countries, Brazil included and Chile, oncology is among the therapeutic areas with the longer times to availability. So I will now hand the floor to my colleague Andre to continue with the presentation, talking about the status of local availability. Thank you, Oscar. Thank you all for joining us today. So, continuing with what Oscar was saying, when we look at the availability rates, and this is a regional comparison table, and that is why the definitions that we've created with FIFARMA and with the advisors are the closest we are to being able to compare the access levels in the different countries. Before going into a deep dive on this information, we can first look at the fact that there are countries like Argentina, Brazil, Chile that have these gray areas that are a bit larger. And these are countries that have a private healthcare system that is a little bit more developed. In fact, most countries have private systems, but oftentimes they are just a premium access to better services, not necessarily to greater availability. So there is a gap between nationally available or limited, like green or yellow. So there's still a gap. And this is also interesting to see that when you look at Brazil and Mexico, there is a gap in the gray areas, and there's this number in red, like Brazil 124 or Mexico 158. These are molecules that are approved, but are not privately available or very little private availability. That is an out-of-pocket gap that we have, because basically where people are paying is from out of their pockets. And we also can see an impact of orphan diseases. It's also interesting to look at countries like Colombia, Peru, that have a national availability with a smaller out-of-pocket, but when we look at the absolute number of molecules, when we look at countries like Peru and Ecuador, the absolute number of molecules is lower. And we can see that countries like Argentina, Brazil, and Mexico have 140 to 200 molecules approved in the time of study, whereas other Central American countries or Andean community countries are closer to 70 or 60 molecules approved. Can move on to the next slide.
Oscar, ¿se puede cambiar el próximo? Entonces, eso es el vistazo inicial. Entonces,
so this is like a first snapshot as a region, but how can we start to make this comparison between orphan and non-orphan? We can first see that there's 180 molecules, 160 that are not orphan and 85 that are non-orphan. The study started focusing on oncology and orphan diseases. In oncology, there is a couple of molecules that can be classified as orphan, particularly in the first indication that we are evaluating. This also reflects the path to innovation in the last 10 to 15 years. We have changed from in the 1990s or in the 2000s, innovation was closer to more prevalent diseases, epidemiologically larger diseases. But we are increasingly seeing targeted treatments and that are going for smaller subpopulations. And when we look at the availability rates in green and yellow between oncology, and we can compare them to non-orphan and orphan, we tend to have similar levels, but you can see that in the orphan diseases, there are many more limitations. So if we compare the part B of non-orphan by therapeutical areas, it's much larger when we compare to the green of the orphans. But if we look at the yellow part in the orphan oncology and we look to non-orphan oncology, they are similar, and this makes it clear that there are still many limitations in terms of the national access.
Y ahí haciendo un otro double click. Entonces, es la misma dispositiva que inicial de huérfanas.
This is the same orphan, non-orphan slide,
Entonces,
but also considering the country component.
Seguro, como he dicho, hay el número absoluto de moléculas huérfanas en el estudio. Acá es más grande.
And the number of orphan molecules in the study is larger. But let's look at in-country availability and how it changes. So, for instance, if we take Colombia, the number of molecules in yellow is much larger. So you can see there are 6 non-orphan molecules in Colombia in yellow. Another interesting topic is that in countries that have a more developed private system, such as Brazil, Chile, look at the orphan side, the gap between the gray area, that is Brazil with 23, and 137, which is the total number of approved molecules. That gap is the out-of-pocket gap. It's much larger within the orphan molecules. Why? Because if there is no access to orphan molecules, if there is no type of institutional access component through a prepaid medicine or private medicine, out-of-pocket will be huge, and it will have a considerable impact on the patient's access to these treatments. When we look at other countries such as Ecuador or Panama, the rates of orphan or non-orphan are very similar in numbers too, but there's still a gap in the entry of more targeted treatments in these countries. But I also believe that it's also interesting to look at Mexico, because it has the same component, as I've said, with Brazil, a huge gap because of out-of-pocket. So that's the difference between the gray area and the red numbers. But in Mexico, the green slice is larger than in orphan diseases, but the total is different because it will be much smaller. So in general, access to orphan molecules is more restricted, and that happens across all countries. It's not something that is specific to one single country. And look at the next indicator, which is availability over time. Oscar, can you move on to the next slide? In fact, this is the indicator that I like the most about this study. This slide
¿Cómo ahí leemos esto? El año que se tiene en los dos lados, entonces, de hecho, es la misma gráfica, pero uno en
so
números
I've used
absolutos.
this same chart, but one has absolute numbers and other has relative numbers.
La visión en absoluto relativo nos da distintas conclusiones.
And this gives us different conclusions.
¿Cómo interpretamos esto?
First, how can we interpret this chart from 2014, 2024, and the year of approval of the molecule by the FDA or EMA? And so in green, yellow, or gray, we can see the axis. And if we look to the left, we can see much more green, much more yellow. Maybe these are the older ones. And on the right, you can see not only a lot more red in the relative chart, but in the absolute number of molecules, we can see that it's also much smaller. So the maturity of the things that we have access to in Latin America is old. So innovation is not getting to us. It's being approved. There is a certain, it's a much faster speed. Surely it's not so easy from regulatory approvals until the HTA assessment and budgeting. But when we look at the left part of the absolute part, after 2019, the total number of molecules that has at least private access, that is gray, is still very low. So this is not only the fact that the portfolio that the countries have available is old, but it's increasingly smaller. So there is a very significant gap in terms of the fact that innovation that is getting there is not getting to the actual patients. And these two charts lead us to see that if we leave HTA activity as something that is evaluated initially, but if we make the decisions to cover these gaps and start making these assessments, looking at the most innovative aspects to therapy, and look at the portfolio, the new portfolio as a whole, and it will take for around 5 to 8 years to reach patients. Let us look at devices, which is a complementary indicator. What we call the improvement index shows how many molecules change their availability status. So limited moved on to total or full availability, or only privately available moved on to limited availability. I believe that this not necessarily validates that the innovation portfolio in Latin America is so old, but is not working as fast as regulatory approvals are. So in green, we can see what has changed the status. So of all the molecules
que están aprobadas desde 2014,
that have
solo
access since
1% lo
2014,
cambian de estatus, es muy
only
bajo. Entonces,
10%
también
that
refleja
change
por qué
status. That's
la
very
fachada
low.
anterior
And this
es
is
una
also
muy
very important to
interesante.
see
Porque no
from the
solo
previous talk
evaluamos lo que
to
está
look at what
pasando,
is
pero
old or what
los
is
sistemas
uh,
no pueden evaluar en la misma velocidad que la evaluación está
because
aprobada
the
y
systems
se puede
cannot
evaluar mejor.
evaluate
Y
at the
más
same
se más allí,
speed
pudiéramos
at
tener
which things are
enfermedades
being
huérfanas
approved.
o mismo enfermedades que son de alta complejidad.
And if we look at high
No hay como
complexity
es out of pocket.
diseases,
Ningún
there
paciente lo puede
is
pagar del
no
bolsillo. Eso es muy
out of pocket
entonces, esa es
full
una negociación muy importante. Y el segundo
availability.
es que
No patient can
no es
pay
solo
for it
mirar el
out of
tiempo
pocket fully.
en realidad,
So it's
pero
not only about
la
looking at
calidad del
time to
acceso.
availability, but
Esos
the
dos
quality
indicadores
of access.
nos muestran
These
que la
two
calidad de acceso en Latinoamérica
indicators show
no está
the
como es
quality of access in Latin America is not doing
en el mundo.
as it should be
Oscar,
doing as compared
le
to the
paso a
rest
usted
of the world.
la palabra.
Oscar, I will hand the
Muchas
floor to
gracias,
you
Andrew.
back.
Ahí entonces, en resumen de los resultados del
Thank you
estudio
so
del
much,
weight,
Andrew. So, in
vemos
summary
cuatro áreas,
of the
cuatro
results of the weight
métricas,
study,
y vimos
we
que
see four
primero el
areas,
tiempo
four
de
metrics, and we
disponibilidad
saw that
indica
first,
que
the
hay un
time
camino
of
largo
availability
y
means that there
fragmentado
is
a acceso.
a long and
Luego
fragmented
vimos
path
el
towards
estatus de
access.
disponibilidad.
And then we
Y
saw
esto
the
nos
availability
muestra que la
status.
mayoría de los
And this shows
pacientes,
us
los
that
que
the
están
majority of patients, the ones that
dependiendo del
are
sector
actually
público para acceso
depending
a
on
estos
the public
medicamentos
sector to have
innovadores
access to these
nuevos, la
innovative and
mayoría
new
solo tienen
medications,
acceso a una
most
fracción de
only
las
have access to a
moléculas.
fraction of the
Tercero,
molecules.
disponibilidad a través del
Third,
tiempo.
the availability
Hay
in time.
ciertos techos, hay
So there are
ciertos
certain
límites
caps
en
or
cuanto
limits
hasta dónde
in
pueden
regards
llegar en dado país y en
to
la
where
región,
they
que
can
el
get to in
tiempo
a specific
ya no
region
mejora
or
hasta que
country.
quizá
That
haya
time doesn't improve until
liberación del
there's
patente, ¿no? Y
a
eso puede
release of the
tardar hasta
patent,
10 o más años.
and
Y
that
en
can
cuarto
take up
lugar,
to 10
el
years or
índice
more.
de
And then in
mejora.
the fourth place,
En algunos
the
casos,
improvement
lento y
index. In some
seguro,
cases,
sí
slow
funciona y hay
and
un
steady,
camino,
and it does
aunque
work,
sea
and there
largo,
is a path, even
pero
if it's
no
long,
basta. No
but
es
it's not
para
enough.
todos y no es
It's not for
suficiente porque
everyone,
estamos
and it's
viendo
not
un
enough
que está
because we're seeing
tardando más
that
y
it's
menos
taking
están
more
pasando por todo el proceso
and
de
there
acceso para
and
llegar a
less
los
are going
pacientes.
through all the access
Entonces,
process to get to all of
en
the
la segunda
patients.
parte, la
So
parte
in the
complementaria,
second
es
part, the
hablar acerca de las
complementary
causas
part
raíces.
is about talking
¿Por
about
qué
the
se da
root causes.
acceso así hoy en día en Latinoamérica?
Why, yeah,
Es
in Latin
una
America,
pregunta compleja y queremos
why is the
representar
problem with what
únicamente
is the problem with
algunos de
access? Is
los
a complex
hallazgos de
question, and
este
we want to
estudio
represent
a
only a
nivel
few
más
of the
macro.
findings of this study
Y
at a higher level.
identificamos este balance
And we
entre la
identified
innovación
this balance
y los
between
sistemas y
innovation
financiamiento, que es
and the
fundamental para que
systems and
haya
funding, which is
acceso. Nuevos
fundamental to
medicamentos
be able to
y
have access. New
las
medications
organizaciones, las
and
entidades que
the
cubren esos
organizations or the
medicamentos para los
entities that
pacientes.
cover those medications
Y
for the
este
patients.
balance en cada país
And
tiene
this
una forma
balance in
distinta y
each country
manifestaciones
has
de
a
cuando no
different
hay un
form and
balance
different
diferentes,
manifestations of what happens when there is no
incluyendo
balance.
los tres
And it
pasos para
can
llegar
vary,
a acceso.
including
El
the three steps to
sometimiento
reach access:
regulatorio, la
regulatory
evaluación de valor de
submission,
una nueva
the
tecnología y
evaluation of value of
decisión
a
de
new technology,
reembolso y
and the
la
reimbursement
compra y
decision
distribución
and
de
the
esos
purchase and
medicamentos una vez que una
distribution of
decisión
these
está
medications
hecha.
once
Vamos a hablar de
a
manera breve
decision has
acerca
been
de estos
reached.
aspectos.
And we're going to speak very briefly
Empezando
about
con
these
la
aspects,
innovación.
starting with
¿Cuál es el
innovation.
estatus? ¿Cómo es el desarrollo
What
de
is the
nuevos
status?
medicamentos?
What's the
Y lo que
development of
podemos
new
ver tanto en las
medications like?
gráficas que
And what we
Andre
can see
presentó,
both in the graphs that
así
Andre
como en
presented,
esta donde está
as well as in
agregado
this
entre
one,
todos los
where
países y los
it's
nuevos
added
medicamentos,
between all the countries and the new
están
medications.
aumentando el número de
They're
nuevos
increasing
medicamentos
the
año
number
con
of
año que
new
están
medications
disponibles
year by
a nivel
year,
global. Identificamos una tasa de
globally.
crecimiento del 1% aproximadamente
And we identified a
y,
growth
como
rate of
pueden observar
1%.
en azul oscuro, la tasa de aprobación en
As we
Latinoamérica
can observe in
empieza a
dark blue,
bajar
the observation
para
rate
los
in Latin
nuevos
America
medicamentos,
starts
en
going down for the
particular a
new
partir de
medications,
la pandemia
specifically
de COVID. Entonces,
after
hay
the
más
pandemic of
medicamentos, hay
COVID-19.
más
So there are
breakthroughs
more
para
medications,
pacientes
there are more
cada
breakthroughs
año.
for patients
Sin embargo,
each year. However,
enfrentan retos a acceso en Latinoamérica,
they
como hemos
face
hablado
challenges to
anteriormente.
access in Latin America,
La
as we
segunda
have
parte de esto es la
mentioned before.
calidad de
The second
estas
part of this is the
aprobaciones, estas nuevas
quality
moléculas.
of these
Y lo
approvals,
que
these new
identificamos fue
molecules, and what we
que
identified
las
was
moléculas hoy en
that
día,
the molecules
para llegar a
nowadays,
un breakthrough en un área
to be able to reach
terapéutica,
a breakthrough in a therapeutic
es
area,
más complejo. Las
it's
medicinas
more
por
complex.
naturaleza
The
y el
medicine,
desarrollo
per
asociado
nature
es
and
más
the associated
complejo.
development is more
Dividimos las
complex.
moléculas con base
We
en
divided
una
molecules
manera de
based
evaluar la
on a
complejidad de
way
ellas.
of evaluating their complexity.
Aproximadamente la mitad de
And
las
approximately
moléculas las
half of the
clasificamos como
molecules are
más alta
classified
complejidad
as higher
versus más baja
complexity
complejidad, basada
versus
en
lower
las
complexity,
poblaciones que están
based
estudiando,
on
a lo mejor
the
son más
populations
difíciles de
that are being
identificar
studied, maybe
y más,
are more difficult to identify
difíciles de tratar y estudiar.
and more difficult to treat
En
and to
si
study.
son síntesis química o
If they are
biológicas o terapias
chemical
avanzadas que
synthesis or
conllevan
biological or
diferentes
advanced therapy
implicaciones para el
that
desarrollo de las mismas.
have
Si
different
son de
implications for their
especialidad
development.
o si
If
son
they're like
a través
specialty or if this is through
los médicos generales, la receta y el
GPs,
tratamiento y
their
monitoreo,
prescription and
mediciones
treatment
de
and monitoring,
precisión que requieren
precision
diagnósticos
monitoring
o
that
son muy
require
targeteadas
diagnosis,
en
or
su
are they very
mecanismo,
targeted
y
in their
también si son
mechanism?
mecanismos
And
nuevos.
also, if they
Vimos
are
que
new
son
mechanisms.
más
And we
complejos
saw
los medicamentos hoy en día
that
para llegar a ese
medications are
nivel
more
de
complex today to
breakthrough.
reach that
Entonces voy a
breakthrough
pasar la
level.
palabra de nuevo
So
a mi
I'm going to
compañero
hand the floor
André
again
para explicar un poco más
to
del lado
Andre
de
to
sistemas y
explain
financiamiento.
again on the systems and funding.
Gracias, Oscar.
Thank you so
Entonces,
much.
y ahí, entonces, esto,
And now,
que se fue bastante importante esto que llamamos
this
el
was
root
very
causes, y
important
se puede pasar a la
in
próxima
what we call the
diapositiva,
root
Oscar.
causes.
Es que
Can
también,
you go to the next slide,
¿por
please,
qué
Oscar?
tenemos esos números? Entonces,
And it's
¿cómo podemos evaluar,
how can we
llegar a conclusiones?
assess
Entonces,
or
primero,
reach
cuando miramos
conclusions?
la diapositiva,
So first of all, when we
la
look
escala de economía, ese más
at
plata,
the
se puede
economy
ayudar a
scale,
tener más
is with
innovación,
more
¿no?
money, we
Entonces, cuando
can
ahí
help
miramos
to have more
la
innovation. So here,
disponibilidad agregada, entonces países
we
como
look at the added
México,
availability. So
Brasil,
countries
Argentina,
like
Colombia tienen más
Mexico, Brazil,
disponibilidad,
Argentina,
pero
Colombia
también es
have more
importante ahí
availability, but it's
tomar
also important there
el factor que
to
también
take
existe en
the
cuán
factor that
rápido la innovación
also
llega,
exists
por el tema
on
de la
how
relevancia
fast
del país,
it
del tamaño de la
arrives
economía
because of the
adentro del
relevance of the
mercado
country, the
mundial.
size of the
Entonces,
economy that
cuando
within
miramos
the world market. So when we
el
look
GDP
at
más
it
grande,
at the
lo
largest
trace
GDP,
y ahí tienen más una economía más
this is
desarrollada, con más
a
plata,
more
lo trace más
for a more developed
disponibilidad.
economy with more
Ahí
money. There's
si
more
comparamos México,
availability.
Brasil
Here, if we
con
compare
Argentina y
Mexico
Colombia,
and
no
Brazil with
necesariamente.
Argentina and
De
Colombia,
hecho,
not
miramos que
necessarily.
Brasil, Colombia,
Actually,
México,
we see that Brazil, Colombia,
Argentina
Mexico,
tienen una disponibilidad
Argentina
más grande cuando se
have
compara a los
a
países
higher
como Chile,
availability when we
Perú, los
compare to
países
countries like Chile,
Ecuador en
Peru,
Centroamérica. Pero
Ecuador,
también hay
Central
este
America.
punto,
But also to this
la
point,
innovación tende a
innovation
llegar, y ahí miramos también los
tends
tiempos
to
que tenemos,
arrive, and we
tende
look at
a
the times
llegar
that we
por
have.
primero en esos
It
países
tends
más
to
grandes.
arrive
Entonces también
first
no es solo un
at those larger
componente
countries. So it's not
de más
just
plata o de más
a component
escalabilidad
of
de la
more money
economía,
or more
pero también
scalability
un
of
componente de
economy,
prioridad,
but more
dentro
a
de
component
los
of
mercados
priority
mundiales.
within the world
Y ahí
markets.
entonces miramos, no, si
So here
pones
we
la
see,
escalabilidad de
for
la
example,
economía,
if
entonces
if
miremos con
because
el
of
per cápita, ¿no?
economy
Entonces, si vamos
scalability,
a la
let's look
próxima
at per
diapositiva,
capita.
ahí comparamos la mesa de
So if we look
disponibilidad
at the availability,
agregada,
we
que es
look at the added
bottom a la derecha,
availability.
más disponibilidad,
Um,
pero ahí ahora no
but here,
el tamaño de la economía con el GDP, pero
when we look at the size of the
el,
economy with the
el gasto
GDP
de
and
healthcare
the
per cápita.
expense of
Entonces,
healthcare,
más inversión en
so
healthcare
more invention
lo trae más innovación. Y
uh,
ahí miramos interesante
brings
porque
more
antes
innovation. And we
Brasil
see
y
that it's
Argentina
more
estaban más arriba
interesting because Brazil and
de la gráfica
Argentina
y ahora
are
miramos países,
higher up
Argentina y
in
Colombia,
the graph. And we
que
look at
tienen
other countries like Argentina
un
and
GDP,
Colombia
un gasto
that have
con salud per cápita un poco más alto,
a higher
con los mismos niveles de
expense in
disponibilidad
health
que
per
tiene ahí
capita with the
Brasil y
same levels
México.
of
Entonces,
availability that Brazil and
de hecho,
Mexico
hay un
have.
componente
Actually, there
de
is a
cuánto
component
se gasta per cápita,
of
pero
how
también
much
hay un
is
componente
spent
de
per
cómo se
capita,
gasta per cápita.
but there's
Entonces,
also a
ahí
component of
que es muy
how
interesante
the
el
expenditure is
ejemplo de
done per
Chile,
capita.
que de hecho
So
tiene
that's where the
uno de los
example of
gastos
Chile is very interesting, where we
grande
have
per cápita en salud,
some of the
pero no
larger
tiene la
cases per
disponibilidad.
capita in
Y ahí
health,
también es un
but they don't
componente de cómo
have
el
the
sistema
availability. And this is
se
also a
organiza.
component
Entonces,
of
El
how the
sistema
system is
chileno, de hecho,
organized.
tiene un
So the
sistema
Chilean
privado
system,
desarrollado, entonces grande comparado a
um,
otros países, mismo a otros países del mundo,
and
pero al
compared
mismo
with other countries
tiempo
other countries in the world, but
un
also at the
punto
same
en
time,
Chile del acceso
there's a point
nacional
in
público.
Chile
Entonces, es un formulario muy
of
restricto.
the public
Entonces,
national
no
access. So
necesariamente
this
el
is very
gasto
strict.
que se
So it's
hace
not
per cápita en
necessarily the
Chile se
expense that is
refleje en
made
el
per
organismo,
capita in Chile
pero al
that is
mismo
reflected in
tiempo, cuando se
medication.
mira, se compara ahí México, Brasil y Colombia,
And when we compare
hay un
Mexico,
gasto muy
Brazil, and
similar.
Colombia,
Entonces, y de hecho,
um,
Brasil, Colombia y México son los sistemas que están más
so
desarrollados
Brazil,
con
Colombia, and
a la
Mexico
actividad
are
de HTA.
two
Entonces, con
systems that are
CONITEP,
more
con el
developed in
consejo, el
HTA
compendio,
activities. So
con
when
el
we look at
IEX
the council, the
en Colombia.
compendium
Entonces,
in Colombia,
esto es un gasto
this
más comparado a Argentina, más
is an
pequeño,
expense that is
pero con
more
el
compared
mismo
to
nivel de disponibilidad.
Argentina,
Entonces,
smaller,
también
but with the
muestra
same
que
level
la
of
organización del
availability. And
sistema
this also shows
en
that the
procesos más
organization
formales
of
de
the system
HTA,
in more
lo mismo de
formal
evaluación
HTA
de
processes,
análisis
um,
económicas
when we look at the evaluation
adentro,
of economic
lo
analysis
reflete
from within, this
a una mejor
reflects
eficiencia del sistema.
a
Comparado,
better
por ejemplo, Argentina
efficiency
aún
of the
muy
system. For
fragmentado.
example, Argentina is very
Históricamente
fragmented if we
lo
compare it
trabajan para tener una
historically.
agencia, pero aún no está establecida.
They're
Entonces,
working on it
ese
to
es un
have an
punto bastante
agency, but
interesante,
it's
que no es
not
solo
established
cuánta
yet. So this
plata,
point will
no
be
es
interesting.
solo
It's not just
más
how much
plata por
money
persona
or
en
more
healthcare,
money per
pero
person
también
in
cómo
healthcare,
organizar los
but
sistemas en sí.
also
Y
how
ahí paso la
organized
palabra
are
a
the
mi compañero
systems. And
Oscar.
here I hand the floor to Oscar.
Muchas gracias, Andre.
Thank you
Entonces
so
vemos
much,
que la
Andre.
innovación va en aumento
So we see
y
that
está
innovation is
presentando
increasing
síntomas de saturación para los
and it's
sistemas.
showing
El
symptoms of
mismo que subraya
saturation for the
diferentes
systems.
temas relacionados con la organización de los
And this
mismos,
also
como Andre
highlights
mencionó.
uh,
Y eso
problems related to
vemos
the
en el weight,
organizations
que
and the
está
organisms. And
alentando
as Andre mentioned, and we
procesos de
see this in the
evaluación
weight,
y
this is
alentando
encouraging evaluation
acceso,
processes
causando
and access
causando una situación y un panorama
and causing a
más retador
situation
hoy en día.
and in a more challenging
Entonces,
landscape.
para concluir, tenemos algunas áreas que mencionamos solo
So to conclude, we have some areas that we mentioned
ejemplificar algunos de los
only to
diferentes retos
exemplify
que se
some of the
presentan a
different
raíz
challenges
de
that happen
estos aspectos relacionados con
because of
innovación y
these
sistema y
aspects related to
financiamiento. En el proceso
innovation
regulatorio y
and funding in the regulatory
estas
process,
mismas
and
áreas reflejan
these
a lo
two
largo del
areas
proceso
reflect this along the process,
capacidad
and they reflect
institucional, donde hay
institutional capacity,
escasez de talento,
where there's a
expertise,
scarcity of
conocimientos para
talent,
evaluar
expertise, and
nuevas
knowledge to
tecnologías más
assess
complejas.
new
Es un
technologies
área
that are more complex, and
importante
this is an
donde
important
vemos
area
reflejado en casi toda la
where we
región
see
deficiencias
reflected in almost
importantes.
the entire region, we
Transparencia
see
y
important deficiencies.
consistencia es
Transparency and
otra área
consistency
importante donde los
is
procesos
another
se vuelven
important
más
area,
opacos y menos
and the processes
consistentes, el
become
mismo que provoca
like
menos
shadier and less
predictibilidad
consistent,
para
and this
las
causes less
empresas y los
predictability
laboratorios que los están
for
desarrollando.
companies and labs that are developing.
Coordinación entre agencias y
Coordination
entre diferentes actores dentro de las mismas
between different
agencias
actors
puede
within
causar un proceso
both within the
desarticulado
actual agencies
y
can
alargado.
cause a
Pasando a la fase de
de-articulated process that is
reembolsos
longer.
y
Now going to the
evaluación de
reimbursement phase
tecnologías, la
and
madurez e
evaluation of technologies,
integración del
maturity and
proceso de
integration
evaluación
of the
HTA
evaluation process of
o
the
si es un proceso
HTA,
menos maduro,
or if
influye
it's a
mucho
less mature
en los
process,
resultados
has
y
a
los
great influence
tiempos,
on the
así
results and the
como la
times,
metodología
as well
de
as the
asignar un
methodology
precio visible
of
que
assigning
aún
a
toma más
visible price,
importancia en este
which
mundo y
takes
este
more
entorno
importance now
geopolítico.
in this world and this geopolitical environment
Caminos y programas dedicados para
of,
acceso de ciertas tecnologías y
programs
acuerdos de
dedicated to
compartir
access to certain
riesgos son
technologies and
elementos
agreements to share
importantes que en su
risks. And these
ausencia
are important
pueden
elements that
también
in their
eh,
absence can also
agravar la situación para ciertos medicamentos
worsen the
y así
situation for certain medications.
implementación una vez que haya una
And thus,
decisión de
implementation once
reembolso,
there is a
una
decision
aprobación
for
regulatoria.
reimbursement,
La
a
última
regulatory
parte del
approval,
proceso todavía
the final
causa
part of the
ciertas barreras
process
debido a
still
alineamiento de
causes a lot of
decisión de
barriers
la
due to
compra
the
y
alignment and
distribución de
execution
medicamentos,
of the
pasos
purchase and
adicionales de
distribution of medications,
negociaciones, ya
additional
sea con
steps
diferentes
of negotiations, and to have
gobiernos
different
regionales,
governments, regional
provinciales,
governments,
que puede impedir
province
el acceso
governments
así
that
como
can
infraestructura y
impede
logística
access as well
para
as
poder
infrastructure and
dar
logistics
estos
to be
medicamentos
able to give these
a los
medications
pacientes en
um,
todos sus estados y en sus países. Entonces,
in all their
con
states
eso
and
concluimos
countries.
y algunos,
So we
algunos
conclude with
pensamientos
that
acerca de
and
cómo
some thoughts
caminar hacia adelante
about how to
y
walk
hacer el
forward
acceso más sostenible
and make
en
access
la
more
región.
sustainable in
Esto
the
se basa
region.
en lo que acabamos de ver,
This is based on what we
transparencia
just
que
saw,
fomenta predictibilidad,
transparency, which
colaboración entre
encourages peace of
actores
mind,
en el sistema que
collaboration
también crea
among
sinergias
stakeholders
y
in the system that also
eficiencias que
creates
son tan necesarias
synergies and
para
efficiencies that are
poder
so
optimizar el
necessary
gasto
to
y
be
una
able to
visión a
optimize
largo
expense
plazo. Con
and
tanta
a
innovación,
long-term
las
vision
cosas
with so
tienen
much
que cambiar,
innovation,
pero tienen
things
que
that need
cambiar
to
en una
change,
manera que sea
but they need to
sostenible,
change in a way that is
pensando en el futuro,
sustainable,
y esto
thinking
promueve
about the
y
future, and this
permite que la
promotes
innovación pueda
and
llegar
allows
a los pacientes.
innovation to be able to
Muchas
get to the
gracias
patients. Thank you
y
so
le cedo la
much.
palabra a Víctor.
And I hand the floor to Victor.
Excelente. Oscar, Andrés, muchas gracias por la
Excellent,
presentación.
Oscar Andres. Thank you so
Buenos
much
días a
for the
todos. Muchas
presentation. Good
gracias,
morning,
Janet y
everyone.
FIFARMA, el equipo por
Thank you so much, Janet
tenerme a
and
mí acá
FIFARMA,
moderando
and
esta
to all the
discusión.
team for
La
allowing
dinámica
me
de
to moderate
ahora
this
tiene el
discussion. And
objetivo
the dynamic right
de
now
ir
has
un
the
poquito
objective
más a
of
fondo
going
en los
a bit
findings y
deeper
la data que
into the
estamos ahí
findings and the
mirando del
data that
weight
we're looking
indicator
at from the
y
weight
con algunas preguntas.
indicator,
Tenemos
and with some
acá
questions.
ya una
So we have
pregunta de la
a
audiencia.
question
Les
here
pido a
from the
todos que están
audience. I
participando
ask
que
you
por
all
favor
who are
incluyan sus
participating here
comentarios o
to please
dudas en el
include your
chat,
comments or
que
doubts in
vamos
the
a hacer lo
chat.
mejor para cubrir ahí
So
las
we're going to
necesidades
do
de
the
todos.
best
Ok,
we can to cover
vamos a
everybody's
empezar
needs.
entonces con una que
So we
tenemos
are going
acá.
to start with one that we
Quería
have
ahí escuchar
here.
de Oscar y
I
también de
wanted to
Andrés
hear
cuál
from
es la
Oscar
visión.
and
La
Andres
pregunta va en
what
la
the
siguiente
vision is, and
dirección.
the question goes in the following
Nosotros
direction.
sabemos que algunas
We
drogas
know that
huérfanas son
some orphan
extremadamente
medications are
caras y
extremely
y
expensive,
nosotros tenemos
and
recursos limitados en los
we
sistemas de
have
salud.
limited resources in the health systems.
¿Cómo piensan que los gobiernos y ministerios
How do you think the
podrían
governments and ministries could
atacar este reto con estos
address this
gastos,
challenge
especialmente
with
en
these
países como
expenses,
los de
especially in
Latinoamérica?
countries like in Latin America?
Bueno, esa es una buena pregunta
Well,
porque es una pregunta que
this was a question, and
que
it was a
estaba
question
haciendo
that
ahí hace años, ¿no? Desde
I have
que
been asking for
la
years
innovación se cambia más a enfermedades huérfanas.
because
La primera cosa
innovation is
importante
switching
acá
more
es que
towards orphan medications.
tomamos
The first part here, which is very important, is that
todo
we
el
take
estudio
all the
es con
studies.
bases en la
All the
indicación
study is
que se
based on
aprobó en
the
el país
indication
por
that was
primero.
approved
Entonces,
in the
muchas
country
moléculas de
first.
estudio tienen
So a
indicaciones que
lot of
son huérfanas,
molecules
pero
under
también tienen
study have
indicaciones que
orphan
no son huérfanas.
indications, but they also have
En
indications that
general,
are
por un
not
tema de
orphan.
clinical trial
So in
y
general,
un tema
because of
de
clinical
cómo
trial issues and
la dinámica de la
how
diversificación
the
clínica se da,
dynamics
muchas veces la primera
um,
indicación que se aprueba es
with
una
a
indicación
clinical
chica, muy
indicator
restricta, y después se va más
is a
amplia.
very, at
Entonces,
the beginning,
esto es
it's usually a
importante cuando miramos
small
acá.
indicator.
Pero
And this is
miramos
important.
que antes de la pandemia tenía como
When we
un
see the
fondo muy
screen,
fuerte de
we
que la
saw that
innovación estaba
there was a very
alta complejidad.
important
En la
aspect
pandemia nos dio sé
or
que
focus on the fact that innovation
tuve un
was based
cambio
on this.
también
And there was a change
como un
also,
balance entre lo que es primary care,
or
lo que es la
balance
estructura del
between
sistema
what the
con
structure
la
of the
innovación.
system is
Pero una cosa
with
importante que también
innovation.
discutimos es que
But one thing that's
el
important that we
presupuesto de
discuss
medicamentos en un sistema
is
de
that
salud
the budget of medications
está
in a
lejos de
health
ser la
system
parte más grande.
is far
Por
from
más
being
que
in
tomamos las
the
enfermedades
bigger,
huérfanas,
the
es muy
biggest part.
tricky porque
Even though we
nos
take
parece
the
que el
orphan
precio
meds,
unitario
it's tricky because we
un
think that
vial
the unit
es
price
alto,
of a vial
pero cuando se
is
toma
high,
impacto
but when
presupuestal
we take
total
the
y se toma
total
el impacto
impact,
presupuestal total
like budgetary
de
wise,
medicamentos para enfermedades
and we
huérfanas,
take also
es muy
the
bajo.
impact of medications for orphan
Lo pasan el
diseases, it's
5 o
very
10%.
low.
En general, el presupuesto,
So
claro,
in general,
cambia de
of
país a país,
course,
pero el
it changes
presupuesto de
from country
medicamentos
to
en el
country,
sistema
but
no
the
es más
medications
grande que
budget
15%
in
o
a
20%,
system is
tomamos
not
todos los medicamentos, todos.
larger than
Entonces,
15, 20% for
muchas veces
everything.
es peligroso
So
solo
many times
mirar
it's
y es por
dangerous
eso
to
que
just
HTA, que
look,
la
and that's
economía
why
de la salud,
HTA
con
in the
estudios de
health
costo
economy
efectividad,
and the
mismo
cost
que con lineares,
effectivity
con lineares de edad
studies
distintos para enfermedades
with
huérfanas,
different
son
types of
importantes porque
linears for
ellos
orphan diseases
sacan
are important because they take
esta percepción inicial que
this initial
vial es
perception
caro.
that one
Pero cuando se
vial
mira
is
el costo total de la
expensive, but
enfermedad,
when we look at the total
los
course of the
savings que tiene,
disease,
por ejemplo,
the
enfermedades
savings,
huérfanas tiene mucho a tener
like
como
orphan diseases,
admisión hospitalarias,
has
porque se quedan más severas,
a
más
lot of
severas muy
hospital
rápido.
admissions, for
Entonces,
example.
también tiene ese
Um,
componente que
So
tenemos
we
que
also
mirar
have this
la enfermedad
component
como
that we have
todo
to look
y
at.
la
We
importancia
have
de
to
la
look at the disease
enfermedad
as a whole and the
específica
importance of
adentro
the
del
disease
presupuesto del
specifically
gobierno.
more than
Entonces,
and looking
si toma
or more than looking at
presupuesto
the
de primary
government's
care
budget.
en
So
cualquier
we take
gobierno, es
the
mucho más
budget of
grande.
primary
El
care
presupuesto
in
total es
any
mucho más grande
government.
que el
The
presupuesto de
total budget
enfermedades
is
de
much
especialidad,
longer,
enfermedades
much
huérfanas.
larger
Entonces,
than
también
the one for specialty for orphan diseases. So
a la pregunta es que
to your
seamos cada vez
question,
más específicos en no
if
evaluar por
we
precio,
are being more,
por
we have to be
paciente
more and
o
more
precio del
specific and not
vial y
evaluating per
tomamos
price per patient or
las
price
herramientas
per
que tenemos de
vial,
HTA, de
but
farmaconomía,
let's take the rules,
pero muy
the
importante
tools
es
that we
que
have for HCA and the economy. But
y
it's
ahí se
very
tiene
important
esta
because,
evolución de los indicadores
and
de
here we have the
ICE,
evolution of
los
the
thresholds de
indicators
costo-efectividad, que no
and
son
the
herramientas de tomar
thresholds
decisión de sí y
of cost
no,
effectiveness. It's
son
not just
herramientas
about taking the decision of
priorización, de
yes or no, but
tenemos
prioritization.
distintas opciones, el
We have
presupuesto
different
es limitado,
options.
entonces,
The
¿cuál es
budget is
la mejor opción?
limited.
Y por eso también que debemos tratar
What would be
enfermedades
the best
huérfanas y
option?
especialidad,
That's why we have
también
to treat
con
orphan
sus
diseases and
matices
specialties
específicos y no solo
with
mirar
their
el indicador en números
specific
en sí, no.
Excelente. Muy
specificities
bien,
and not
muchas
more
gracias. Me
than just
gusta
looking at the
que
number and
tuvimos
just
un
saying yes
approach
or no.
así
Thank you so much. I like it,
desde
and
el
I like that
micro
we
hasta el
had an
macro.
approach
Yo creo que las
from
partes
the
de
micro to
farmacoeconomía hablan
macro. I
mucho
think
sobre la
that
necesidad de mirar estos análisis.
and
Siempre el
here
cargo, ¿verdad? Tú
we've
tienes
really looked at
una
the
relación con
need to
algo
look at the
y
analysis,
yo
and
creo que
there's always a
estas
relationship, and I
herramientas y
think that these
perspectivas que tú comentas son muy
tools and
importantes. Perspectiva
perspectives that you are
pagador,
commenting are
sociedad,
very
costos
important. The
directos, indirectos, todo
perspectives
esto entra en la
of the
cuenta
payer,
y me
society,
gusta
direct costs and
siempre
direct costs.
atacar que hay
And I always like to
tecnologías que
address that there's
tienen
technologies that
un uso
have
más eficientes de recursos que
more
son no
efficient
sustitutos,
use
¿no?
of
Cuando
resources that are
nosotros
not
ahorramos tiempos
substitutes.
del
When
sistema de
we
salud para
save
profesionales de salud
time
no se crean
for
de un día a otro.
professionals,
Entonces hay
healthcare
recursos que son
professionals are
mucho
not
más
created from one
complicados
day
de
to the
obtener
next.
y muchas de estas tecnologías traen eficiencias en esta dirección.
And many of these
Muy bien,
technologies bring
perfecto. Veo que
efficiencies in
vamos
this
teniendo acá más
sense.
preguntas y yo creo que a
I
lo largo de las
see
próximas tal vez pueda comentar un
that we have
poco
more
a
questions, and maybe
Oscar
along the next ones
y
I can
también Andrés
comment to
sobre las
Oscar and
conclusiones que
Andres
vimos en la última
on the
slide. Yo creo que hay
conclusions
componentes más macro
that we
como el
have on the
tema de
next slide. I
transparencia,
think there's
negociaciones,
more
que
macro
ojalá
components like
afectan
transparency
esta
and
percepción inicial
negotiations
de
that
precio, pero yo creo que va a
I'm
venir en
assuming
otras
will affect
preguntas
this
acá.
initial
Voy a
perception of
traer una
price, but this will be
segunda
coming in more
que
questions. I'm
es
going to
de
bring a
José,
second one,
que trae la pregunta
and
que
it's
cuáles
by
son los
Jose.
principales
He's bringing the
factores
question on
comunes y
what
las
are the main
principales
common
diferencias que explican
factors
las
and the main
demoras en la región.
differences that explain the
¿Creen que los
delays in the
tiempos de
region?
espera en Latinoamérica
Do you
reflejan
think
más
that
un
the
problema de
wait
gestión
times in Latin
pública o de
America
prioridades
reflect
públicas?
more a public management problem or
¿Cuáles
public
son sus
priorities?
opiniones?
What are your opinions?
Bueno, la prioridad la
A
pregunta es, ¿el
priority,
sistema es
the question
subfinanciado o es mal gerido?
is the
¿No?
system financed
La
or
pregunta es que a mí no me parece decir que
subsidized?
es mal gerido, no es el punto, pero sistemas de
So
salud son muy complejos. Por
health
eso los
systems are
llamamos
very
sistemas.
complex.
No es como, no es una empresa, es como, es todo
It's not a
coordinación
company.
de largo plazo. Salud no se hace en 2 años.
So coordination
Muchas de las decisiones
is
que
long
tomamos hoy
terms. Health
estamos
doesn't
mirando
happen
ahí
in
a
2
5,
years. Many of
10,
the
15
decisions
años.
that we are
Y ahí
making
los sistemas de
today
salud es muy
um,
importante que en el
are
lado
made
de
in
la
5 or 10
gestión
are
tener como
we're seeing things
consistencia
of 5 or
de
10 years
que
ago.
se
So
queda
it's
con las
looking about
políticas se
having
implementan, porque
consistency
hacíamos
with the
planos,
policies that are implemented, because
anunciamos cambios e
we announce
iniciativas,
changes
pero
and
también tiene que tener
initiatives, and
paciencia que el
we also have
sistema
to be
se daña
patient
a
that the
cada uno
system
todos los días, se queda 1% mejor. Entonces, no es
makes
tan
or
simple
becomes
tener
better
grandes cambios.
every day,
Entonces,
like 1%. It's not about
a
large
mí
changes.
lo que me parece es que
Um,
tiene que existir un esfuerzo continuo
so there has to
de
be a
mejora en el
continuous
sistema, en los
effort for
procesos.
improvement in the
Y ahí
system
me
and the
gusta, por ejemplo, el
processes.
ejemplo que utilicé de
And I like the
Conitec,
example that I used
del
there
Consejo
of
en México de
the
ayer,
council
las
in
iniciativas que
Mexico,
tiene ahí Argentina con la agencia de
the
HTA,
initiatives that
las iniciativas
we have
adentro de
with the
Chile
agency,
y
with
de otros
Argentina, with
países,
HTA, and when we
que
look at
esto,
Chile.
la historia de Conitec se muestra, por ejemplo,
But the
cómo
story of Conitec
evoluimos de
shows how we
negociaciones
evolved
comerciales
from
para
commercial
un proceso.
Y
Y
to a
ahí que me
process.
parece que donde está, por
And
ejemplo,
there is
no
where I
solo en
think
HTA,
is,
HTA es un
for example,
ejemplo,
not just in
pero por ejemplo
HCA.
ahora
HCA
estamos
is an example, but
haciendo
for
evoluciones
right now
en
we're doing this
está vencido, pero ahora los acuerdos de
uh,
risk sharing,
this the
modelos
risk sharing,
alternativos de
for
financiación.
example,
Entonces,
the creative
esto
financing models,
tiene que
and all of
pasar
this
de
has to go
discusiones, de
through
retos para
discussions,
procesos.
through challenges, and
¿Cómo
all the way to
abrir la
processes.
discusión de la
So
mejora de las
how to
esas moléculas
have the
de alto
discussion of
costo, huérfanos, alta
improvement of
complejidad, lo
access
pasa por
to high cost
implementar lo que estamos
medications or
discutiendo
orphan
de
diseases, and then we
reward
go through
networks,
implementing what we're discussing,
mecanismos alternativos de financiación,
the
risk
alternative
sharing, de
mechanisms and risk
cambiar de
sharing
la
and
discusión ya hace
changing
8 años, 6 años para implementar. Entonces
to be
llega el
able to
momento en
be
que
implemented. So
sabemos que
it's the
esa es la
moment
solución
where we know that
factible,
there
pero ahora
is a feasible
tornar un
solution,
proceso. ¿Y cómo tornamos un
and
proceso?
we know
Va a
that
haber la
there's a process.
discusión,
And how do
abrir la
we
discusión
have
de la
a
mejora
process?
para estas enfermedades. Está cómo vamos a
So we have the
implementar
improvement and
estos
how we are going
procesos
to
de
implement these
acuerdos
processes
innovadores, de modelos
of
alternativos.
innovative agreements and these models.
Excelente. Muy bien.
Excellent.
Estamos llegando al
Thank you.
final. Vamos
We
a
are
hacer acá un
reaching
esfuerzo
the
para
end.
ir
We are going
rápido y
to
ver
make
si
an
cubrimos
effort to go
algunas otras
really
preguntas
quickly
que
and see
tenemos.
if we can cover a
¿Cómo se
few of
compara el
the other
acceso en
questions that we have.
Latinoamérica con otras
So how do
partes
we
del
compare
mundo?
the access in
¿Y
Latin
cuáles
America
son
to
algunas de
other
las
parts
principales
of the world, and
diferencias?
what are some of the main
Andrés, Oscar,
differences?
¿tiene una opinión ahí?
Andres, Oscar, in opinions?
Sí, claro, muchas gracias, Víctor.
Yes,
Entonces,
thank you so much, Vito.
en América Latina tenemos
So
una
in Latin
región
America, we have a region
fragmentada. Cada sistema opera de
that is
manera independiente y
fragmented,
opera de manera única y distinta. Hay
and this
ciertos
operates
elementos,
in
tanto en
a
Estados Unidos, donde
unique
aunque
and different
haya
way. There are certain elements that,
mayor fragmentación
even
entre los
though
planes y los
there's
pagadores y el
greater
acceso,
fragmentation
hay un consenso y hay cierta
between
data que se
payers and
utiliza de
access, there
manera
is a
nacional y se
consensus,
hace
and
referencia.
that is used
Y hay
nationally, and we
hay
do
gran
reference.
inversión en el sistema para
And there's
cuidar la
great
salud de otros. En Europa tenemos un
intervention
sistema
in the health
regulatoria
system.
centralizada que permite que haya
And in Europe, we
oportunidad
have
de
a
acceso en
centralized system that
distintos
allows to have
países.
access
Y estos
opportunity in different
elementos, el gasto en
countries.
salud en Estados Unidos,
And
la
these elements
centralización de ciertos
in
aspectos en
the
Europa y se está buscando
health
la
expense in
evaluación
the
de
United States
tecnologías
and
de
in
manera
Europe, and we're
centralizada
looking
también en
at
Europa.
the access to technology in a
Permite que
centralized
haya
manner in Europe,
diferentes panoramas de acceso
allows
y hay
to have
algunas áreas donde
different
estos se lanzan primero
landscapes
en
and
otras
access,
áreas
and
del
to
mundo,
that there are some
donde
areas
en Latinoamérica
where
podemos
this is launched
mirar,
first,
aprender
where in Latin
y
America
hay
we
por las
can
mismas
learn
demoras que
and
existen en
see, and because of the delays
Latinoamérica, oportunidad de
that there are in
aprender
Latin America,
de
look
los
to see if there's
lanzamientos
opportunity
y
to
de las
learn
evaluaciones de
from launches and
tecnologías en
evaluations
otros
of
países.
technologies in
Creo que eso
other
es
countries.
importante
And
y
I think
hay
that's
muchos que
important.
podemos hablar, pero por el
And
momento
there's
creo
maybe
que
a
sí
lot that we
Y
can
es posible
talk,
solo
but
comentar.
for
un
now,
comentario, Oscar, es
I think
que
we don't have a lot of time.
Latinoamérica, los sistemas se
Latin
diseñaron
America,
de manera, tenemos la cultura de salud
we
pública
have the
muy fuerte. Esto
culture of
viene
public
ahí
health that is very
del
strong.
PAHO, viso de CEPAL. Pero entonces los sistemas son muy bien diseñados.
So the systems are very well
Hechos para
designed.
que podemos a tener la salud amplia a la población
So we can
grande
have
en países de
broad
low middle
health
income.
care in
Pero en
low
la
to middle
práctica,
income
lo
countries.
que está en la ley no necesariamente lo pasa. Y ahí con el tiempo, los sistemas de
And what happens
Latinoamérica,
is with
distintos
time,
de
the
sistemas de Europa, que
systems in
también son
Latin
de salud
America are
pública,
different from the systems in Europe where
aprenderon
we have
a
in public health,
encontrar mecanismos
is to learn how to
alternativos
find
hasta que llegamos
mechanisms that
a
are
la estación
alternative
nacional, por ejemplo.
so that we
Entonces,
can
los
get to the
sistemas de
national
Latinoamérica son muy bottom-up.
system. So
Empiezan con
the
privado, van
systems in
mucho a
Latin
los
America are
estados,
very much bottom up.
provincias,
So they
o
start with
pagadores
private, they
como
go to the states and provinces
las
or
Fuerzas
payers like
Armadas
the
o por
armed
México, Pemex,
forces,
Sedena, Seman. Entonces, hay
or
como una
so
fase
there's like
inicial de
an
acceso
initial
de
phase for
bajo a
access,
arriba, fragmentado, hasta que
top,
llegamos
but
al
no,
acceso
bottom
nacional,
up, that is
ya distinto de
fragmented
Europa
until
que
we
ya se
reach
empieza
national
con el
access.
nacional, ya hasta
Different from
que
Europe that
esto
starts
cuando
with
se
the
miran
national
las
access
diapositivas,
until it
después de
starts.
que
And when
tiene
we look
tanto
at the
amarillo
slides,
no
that's why
tanto
there's so
verde,
much yellow
porque
and
estos
not so much
procesos en los
green.
primeros 3, 5 años
But
que
these
están se
processes in the first 3
acomodando
or 5
antes que
years,
van a
maybe they're
nacional.
starting to
Excelente,
accommodate
muchas
before they
gracias.
go
Ya
to the national
estamos en
level.
la hora
Thank you so
y
much.
yo creo que
So it's
más que los
time.
datos
I
y
think that
toda la
more than
riqueza
the
de la información que
data
tenemos en el
the wealth of information that we have in the report that I invite you all to visit and to look in detail at and to get into contact with us so that we can organize and solve any additional doubts. This is a call to, and we have identified together that there are great opportunities in Latin America. A lot of the technologies that are advancing together with medicine and science have the capacity of having a level of a resolution that is super large and to attend to needs that are very present in the populations of Latin America. This gives us a great responsibility then on behalf of FIFARMA and all our representatives. I'd like to put this as a commitment to us to work together and guarantee that these collaborations and advances can be identified in the next reports. Oscar, Andres, thank you so much for the participation and presentation, and Janet and the team of FIFARMA for inviting us. And to those of you who are here and are asking, the recording will be available as soon as we're done. I hope you can keep sharing and keep enjoying these contacts. Thank you so
Gracias,
much and have
Víctor.
a
Gracias,
great
Andrés.
day.
Gracias,
Thank you,
Oscar. Feliz día
Vitor.
para
Thank you,
todos.
Andre. Thank you,
Feliz día.
Oscar. Thank you so
Gracias,
much. Have a
Oscar.
great